So today we'll be talking about practical ways to managing high blood pressure. And this training is particularly useful for persons who have been struggling with high blood pressure without results. If you have been taking multiple medications, you've tried other lifestyle methods, you've used supplements, herbal remedies to no avail, this training is for you. So in this training, I'll be sharing with you practical ways, science-based methods that I've used to manage high blood pressure in clients and patients, which I've also used as a personal, for me as a person. So basically, we'll be looking at a brief overview of high blood pressure so that we'll have a basic understanding of what high blood pressure is about, how it comes, the typical signs and symptoms it presents with. And thereafter, we would move to the meat of the topic today. So my name is Dr. Ogechukwu Isiche. I'm a clinical pharmacist, and I'll be taking you on this. So let's briefly look at high blood pressure. So basically, high blood pressure or hypertension means sustained blood pressure above 140 over 90 millimeter mercury. The 140 is commonly known as systolic, and that's the pressure which the blood leaves the heart. So this is the pressure that gets to other parts of the body apart from the heart. While this diastolic, that's the 90 here, is the pressure with which the blood pressure gets to the heart. So a high diastolic value is usually what damages the heart or does more damage to the heart than the systolic. While the systolic, an elevated systolic blood pressure will of course have more impact on other organs like the eyes, the kidneys, and what have you. So remember that I said it's a sustained elevation. So that means that a one-off reading is not termed the high blood pressure. Typically, high blood pressure is diagnosed after 3 consecutive readings, elevated readings. So normal blood pressure ideally is supposed to be between 105 over 60 millimeter of mercury to 120 over 80 millimeter of mercury under normal condition. However, there is an allowance or a stage called the pre-hypertension. So at this point, the person does not have high blood pressure, but has a high tendency of coming down with high blood pressure. And this is usually between the range of 120 over 80 and 139 to over 89. Sorry, let me just correct that. All right, so let's go back. So the target blood pressure is usually less than 120/80 for people with no other health challenges like diabetes and likes. Whereas for people with diabetes or what we call comorbidities, we have a higher target. So the target is usually less than 130 over 90 millimeter of mercury. So having talked about a brief overview of high blood pressure, it's important to know or to discuss some of the typical triggers. Some persons do not know that they actually have known triggers. So we'll look at the typical triggers of high blood pressure. So we have the avoidable or non-avoidable triggers. So the avoidable triggers are those things that you can actually do away with. We'll briefly talk about them. Why the unavoidable ones are the ones that are that are above or not within your control. So things like age, of course, the higher you age, the higher the chances. There is a research, or there is a statement, medical statement of father says that if we live old enough, we'll stand a high chance of coming down with high blood pressure. So people above 60 years, of course, have higher chances of high blood pressure because of age, wear and tear. High blood pressure is also more common in blacks. than white people or even people of Asian origin. And this is tied to genes, the genetic implication. So if you're an African or a black man, your chances of having high blood pressure is higher than those persons from Asia. It's also higher in people with family history of high blood pressure. And the greater the number of people who are close to you that have high blood pressure, the higher the chances of you coming down with high blood pressure. So imagine a situation where your both parents have high blood pressure. Trust me, the chances are higher for you, but would tell you what to do as per reducing the risks. So pregnancy also predisposes women to high blood pressure. Most women, or some women, actually develop high blood pressure due to what's it called? Pregnancy. You also have what we call high cholesterol, or more medically called dyslipidemia. So when you have a high cholesterol value, of course, cholesterol or dyslipidemia is made up of calcium, it's made up of fats, unhealthy fats and all that. So they block the blood vessels, making it difficult for blood to pass through, and that raises the blood pressure and sustains it at that level. The fact, high cholesterol level is one of the leading causes of high blood pressure, and it's also tied to sustained high blood pressure in people with diabetes. The next on my list is sleep apnea. So this is a condition that occurs where persons have difficulty breathing while they are asleep. So this could be as a result of structural defects, and studies have shown that this can actually increase the risk of somebody coming down with high blood pressure. An interesting trigger here, another interesting trigger here is H. pylori, which causes a peptic ulcer. So H. pylori is a bacteria that causes ulcer, and several studies have tied H. pylori to increase in cholesterol values and of course sustain the blood pressure. So if you have peptic ulcer, for instance, one of the things that you should do is to determine if the ulcer is caused by H. pylori. And of course, if the ulcer is caused by H. pylori, you should do well to strive to eradicate it. And I've seen cases where eradication of H. pylori has led to a drastic reduction in blood pressure and even cholesterol values. The kidney disease is also a risk factor because the kidney is part of the organs that helps to modulate blood pressure or control blood pressure. So when the kidney is not actually working as per the way it's supposed to work, definitely it will impact the blood pressure. And the next is primary aldosteronism. So aldosteronism is an increase in a hormone they call aldosterone. So, and this is usually linked to a tumor in the adrenal gland. So the adrenal gland sits on top of the kidneys. So when this tumor occurs, or when this tumor is there, it basically leads to an increase in the secretion of this hormone called aldosterone. So aldosterone on its own typically leads to the narrowing of the blood vessels and sustained blood pressure increase. We also have thyroid disease. Thyroid disease is one of the leading causes. It's one of the causes of high blood pressure because the thyroid gland, which is here, typically controls the metabolism or the rates of energy. It's part of the organs or the glands that regulate metabolism. So when there's a dysfunction of thyroid gland, of course, that impacts the blood pressure. Then you have cigarette smoking. You have high salt intake. You have sugar and soft drinks, alcohol, processed food, junk food, fast food, uncontrolled stress, lack of exercise, drug abuse, substances like cocaine, heroin, and abuse of medications like painkillers like ibuprofen, diclofenac, indomethacin, piroxicam, and the likes. These lead to what these drugs do is that they increase the retention of water in the blood, and when the blood volume rises, of course, it leads to increased blood pressure. Then we also have diabetes mellitus, like high blood sugar. Let me do a quick recap and look at some of these other ones. High salt intake. Common salt, or the table salt that we eat, is commonly made of sodium and chlorine. And the sodium in there is known to draw water. So sodium, high sodium amounts in the blood actually draws water to itself, increasing water retention and plasma volume or blood volume. So this actually is how salt increases blood pressure. You also have sugar and soft drinks. One of the major components of soft drinks is sugar. And you have sugar in other kinds of food, processed food, and a lot of foods definitely contain sugar. And sugar is known to be pro-inflammatory. Like what that means is that it enables inflammation or swelling. Sugar is also converted into one of the lipids they call triglycerides. So triglycerides, definitely, an increase in triglyceride levels contributes to narrowing of the blood vessels. So you see, this is how sugar actually impacts your blood pressure. You also have alcohol. Overt intake or too much consumption of alcohol has a way of increasing blood pressure. And not just increasing blood pressure, it also has a way of impacting your body weight. You understand? Has a way of impacting your body weight. So, and you know that obesity or being overweight is one of the risk factors of high blood pressure. Then you have processed food, junk food, fast food. Basically, for processed foods are rich in white sugar, unhealthy fats, calories, and all that. And they are low, they're high in sodium too, because most of the times they use salt to preserve these foods. And one of the things you should do when you're buying food, especially processed food from all the counter, is to look at the labels to see the amount of sodium it contains. So if you're the type that eats a lot of fast food, junk food, processed food, trust me, you stand a chance of eating more than the required amount of salt that you're supposed to take per day. We also look at uncontrolled stress. Stress has a way of affecting or sustaining blood pressure. And stress can come in different forms. It can be as a result of your job, relationship, financial stress, what have you. So uncontrolled stress has a way of raising your blood pressure. Then you have lack of physical exercise. People that live what they call sedentary lifestyle, people that sit a lot, have a high chance of coming down with high blood pressure because your body is not moving. And when your body is not moving, definitely, what it does is that you're not using up enough calories, right? So this increases your chances of gaining weight, and of course, other complications. Lack of exercise can also increase your chances of developing issues with your cholesterol values, because exercise helps to moderate your cholesterol, amongst other things, as we will see as we move along. We also talked about drug abuse. Substances of abuse like cocaine, heroin have been implicated. And there's also the abuse of even herbs like licorice. Licorice is a herb that is known to help with digestion. But abuse of or use of licorice can actually increase your chances of coming down with high blood pressure. I think I should add that to the list. So how licorice, yes. All right, so let's move on to the next. Having looked at these triggers, it is important that we also look at some wrong approaches to managing blood pressure. Some wrong approaches to managing blood pressure. If you read a copy of the book, you must have downloaded earlier. I dwelt a lot on the other aspect I just mentioned, so I will not bore you so much with that. So let's move on to the most crucial part, which is this.